The Sinai Medical Foundation Oral History Project is being conducted by the Leonard N. Simons Jewish Community Archives. My name is Howard Nystein, and today's date is July 17th, 2024. I am interviewing Dr. J. Levinson. Dr. Levinson, do you give permission to the Leonard Simons Jewish Community Archives to publish, duplicate, or otherwise use this recording for educational purposes or for use as deemed appropriate by the archives?
Yes, I do.
Okay. So let's start really at the beginning. Where and when were you born?
I was born in 1955 in Detroit.
And where?
Where in Detroit? Back in the old in the old neighborhood by Dexter and Davison.
Okay.
We were there till I was 5, and then moved to the Bagley Elementary School area, Wyoming and Curtis area until I was 10, and then we moved to Southfield.
Okay.
Where I really grew up and went to Southfield High School.
So tell me a little bit about the neighborhoods from what you remember them.
Well, I don't remember a lot about the Dexter-Davison neighborhood because I was 5 when I moved from there, but the Northwest Detroit neighborhood was a great place to be a kid. There was the streets were small. There was lots of kids on the block. There were sidewalks. We played baseball and football in the middle of the street. We had alleys between the blocks. Just a lot of fine memories. Walked to Bagley School every day with friends, and it was a predominantly Jewish group of people that I hung out with. And moving to Southfield, I did my first encounters with a little anti-Semitism was as soon as I moved to Southfield with some of the kids that I went to school with, which was a shock to me. But there was still a significant percentage of Jewish kids, and so that was my predominant group of friends. And
do you remember why your family moved to Southfield?
You know, they were doing well and they wanted a bigger house, so
moving to the suburbs.
Yeah.
And where along this way did you begin to be interested in maybe thinking about being a doctor?
I don't know. As a kid, I thought I was going to be a lawyer, but I don't think I was persuasive enough. So I grew up in a kind of a unique situation that my father was. When my mother was pregnant with me, my father dove in the shallow water off a dock in Cass Lake and broke his neck and became a quadriplegic. And my brothers and I, and my mother and grandfather and grandmother, we all banded together and took care of him. I didn't know any other way. I was in the womb when it happened, and I grew up that way. And so I was involved in a lot of day-to-day care from the time I was pretty young. He was remarkably independent and positive, but and once he was recovered enough, he was able to run the business. We had a clothing store in Oak Park. I worked in the clothing store. I knew that I probably didn't want to do that fairly early on, and I think when I first became really interested in medicine is I think I was around 6th grade, and my grandmother had lymphoma and she was being managed at the Mayo Clinic. And my mother took her to one of her appointments and she decided to take me with her. And I got a chance to see the Mayo Clinic in action. And it was kind of a cool place because we stayed in a hotel. We went through tunnels to get to the clinics and our appointments. And there was this Mayo Museum of Medicine that I was fascinated with, and looking at all these devices that were invented at the Mayo Clinic, some of these artificial heart valves, and that sort of spurred my interest. And so going forward, I was kind of science oriented, and between helping take care of my father and seeing what medical needs were back then, it was very challenging for anybody who was a quadriplegic.
Sure.
And we sort of had to jerry-rig a lot of our own devices to get them going. Nowadays, there's a lot more available. But it was that was sort of what spurred me to be a doctor, and that's kind of I never thought about anything else really. Once I got to college, it was focused on going to med school.
So you mentioned you had brothers. How many brothers did you have?
I have two older brothers. One of them is the oldest brother. Did not go to medical school, but he did a master's in genetics, and then he did a PhD in immunology, and he became a research scientist and fairly accomplished. And then my middle brother Marty, who's done one of these interviews, went to medical school at Wayne State, and I followed in his footsteps. He's a pediatrician and practices in the area. Is on the board also of the Sinai Medical Foundation.
So did they influence you in terms of your own, or affect you in terms of your own career path?
Oh yeah, I was the little brother, and I kind of tried to follow along. I was never as I don't know if I wasn't as smart as them, but I wasn't as dedicated a student as them. So everywhere I went, they said, "You're Sandy and Marty Levinson's brother." They were a lot better students than you were.
Well, they set a high bar.
That kind of spurred me on. They set a high bar, and it kind of spurred me on. I said, "Okay, I got to catch up with these guys, so I don't get dissed too badly."
And when you said that you first became interested, it was like around 6th grade. So you must have been 12-ish years old. Then there was high school. College you went to?
I went to Wayne State, undergrad, and pre-med curriculum. I actually tried to get into med school. After 3 years, you could do that occasionally back then. I got a couple of interviews, but didn't get in. But then after 4th year, after graduating, got into medical school and decided
also at Wayne State?
Yeah, I decided to stay at Wayne State, so that was my best option. We were needed around the house to help take care of the business, help take care of my father, so it worked out best for the family for us to be close at hand.
And when did you first get an exposure to Sinai?
So Wayne State has an affiliation with, or had an affiliation with Sinai's teaching programs, and so I think 3rd year medical school, when you start doing your clinical rotations, I did my psychiatry rotation there, and Dr. Ronald Trunsky, who was one of the great leaders as well as characters of Sinai Hospital, had a profound influence. He was, I think most of us who did their psychiatry rotations at Sinai really loved the guy and cherished the guy, and he was somebody that we looked up to. Then I was actually planning on going into pediatrics like my brother, following in his footsteps. I did not like
your brother Marty.
My brother Marty's footsteps. I didn't particularly care for the feeling of internal medicine down at Wayne State at the rotation that I did as a 3rd year. I thought it was kind of, the people were not so nice, and it was very competitive. And 2 things happened during my 4th year. Number one, I did a rotation with an outpatient pediatrician, Dr. Reuben Kernitz, who was a great guy. And I found that I just didn't like the whole office practice of pediatrics. I just found it was more taking care of the mothers than it was taking care of the kids. So, and Rube Kernitz said, Jay, you should go into pediatric gastroenterology. So I said, maybe. So it was a thought. And then I did my sub-internship at Sinai early in my 4th year. And I was placed with several of the residents who got exposed to Arnold Axelrod, who was chairman of medicine. He was a hematologist, oncologist. And my 2nd month, and I stayed for 2nd month and did hematology with him. So he was a great mentor and influencer, and he saw in me the potential for being an internist as opposed to a pediatrician. And I told him when I went in there that I was going to be a pediatrician. And then there was also Dr. Charlie McEwen, who you've probably heard about, who was the program director for internal medicine, and I developed a relationship with him. So over the course of the 2 months, I really developed this fondness for the whole concept of Sinai Hospital. It was a very high level, high intellectual level. The level of practice was outstanding. There was research going on there. There was all kinds of things going on, but there was a humaneness about it that really clicked with me. And at the end of the 2 months, Axelrod and McEwen basically said, you know, we'd love for you to come do your residency here. So I'd been interviewing for pediatric residencies around the country, and I sort of made a late change and switched into internal medicine, and the rest is history. I did my internship and residency there. And
what were the dates, or the years, so to speak?
So I graduated medical school in 1980. So I was at Sinai as a resident from July of 1980 to June of 1983, 3 years. And really a wonderful time in life. Hard work, intense, a lot of hours, a lot of night call.
Were you married at that time?
I was married, yes. And
when did that happen in all of this?
I got married sort of towards the end of medical school, just before I graduated, and then so it was right before that. And made it through my residency, and during the residency, it's interesting. Dr. Kernitz had brought up the idea of pediatric gastroenterology, so that kind of stuck with me a little bit. And then I looked into whether I wanted to be an internist or I wanted to be a subspecialist, and I decided I wanted to be more of a instead of a jack of all trades, sort of a master of something, and ended up looking at cardiology and at gastroenterology, just thinking I liked sort of some procedural, using my hands as well as my brain, and gastroenterology is just resonated with me. It was just I felt comfortable with the physiology, the anatomy, and so ended up going into gastroenterology. There was a small gastroenterology fellowship at Sinai. It wasn't at that point very high level, and while I was offered a spot there, I decided to shoot a little bit higher, and I ended up at Wayne State, which was a little bit more of an academic and a larger program, and but it was local and in town. So from '83 to '85, I was there. And then when I started looking for a job, I interviewed at a few private practices in a few different areas. Figured I was probably going to stay in town. And Arnold Axelrod was in the process of stepping down as chairman of internal medicine, and Melvin Rubenfire, who was chief of cardiology while I was a resident and somebody I admired greatly, approached me and said, Jay, I would love for you to join the faculty. I'm expanding the faculty. I'm trying to get more full-time teaching faculty here, and he actually recruited Manny Sklar, who had been private practice, but it was chief of gastroenterology. So he basically recruited the two of us as a package deal. Dr. Sklar was 60 years old when I first went into practice with him, and I was 30 years old when I finished my fellowship, and the two of us went into practice together within the Department of Internal Medicine at Sinai, and they set us up in an office in the Bloomberg Professional Building across the parking lot from the hospital, and then they opened an office in the Heckman Building on Telegraph and 13 Mile, and we practiced there, and it was great. I mean, there was.
Were you on staff at Sinai, or was your practice?
I was employed by Sinai Hospital, although patients who came to see me couldn't really tell the difference as to whether I was a private practicing GI doctor. And as I was also tasked with running the fellowship program, so it was an academic challenge that I tackled, and it was sort of a combination hybrid of private practice and academia, and I I asked them to give me a year off of the fellowship program. I wanted to sort of get my feet wet, get grounded, get started, develop a teaching curriculum for the internal medicine residents in gastroenterology, which I did. And then after a year, I was ready to resume the fellowship, and I wanted to take it to a higher level, and we did. And so over the next several years, over the next 10 years, we really had a very robust, although small, gastroenterology fellowship program. I trained quite a few people over the course of the years whom I'm very proud of, and I consider colleagues. In fact, one of the people I trained, Phil Goldmeyer, ended up joining me in practice, and we're still in practice together. I think 7 years or 7 or 8 years into my journey there, I felt we needed a little bit more significant research exposure for our fellows, and so I hired a young guy who was just finishing his fellowship at Henry Ford, who was doing really significant research, clinical research in Helicobacter pylori, which is a bacteria in the stomach that sort of was really a hot topic of research back then. His name is Alan Cutler, and I recruited him. He joined me 31 years ago. We just celebrated our 31st anniversary in practice together, and the rest is history. We worked together with Manny Sklar until the sale came about, and that was kind of a sad time.
So you were at Sinai probably 15 years or so?
Well, I was at Sinai for 3 years during my residency, and then was gone for 2 years for fellowship, and then I was back for 13 years. The first 13 years of my practice was there with Manny Sklar, and then the last few with Alan Cutler as well. And when the DMC decided to buy Sinai, we sort of negotiated, and it's funny, the Sinai administrators ran our practice, and it was so simple and easy, and they were so cooperative, and we had great relationships. And then when DMC took over, they changed administrators every 3 months, and I didn't know who to talk to, and processes in the office just became difficult, complicated. And it became clear, and then the fellowship, they kept making me promises, and eventually reneging on those promises, and so they incorporated our fellowship into the Wayne State Fellowship, which was fine because those were the people that trained me down there, and I had great relationships. But we lost our autonomy, and eventually there was no such thing as the Sinai Fellowship, and then we made a decision that it was time to go. And I actually, the last few years of my tenure at Sinai, I became, Manny Sklar passed the mantle of Chief of Gastroenterology to me, so I became Chief of Gastroenterology. And when the merger first took place, there was Sinai and Grace came together, and I was actually named the Chief of Gastroenterology for the combined Sinai and Grace. And we had made plans to move Grace over to Sinai, and then sort of the Hunter group came in and made some recommendations, and in the end, it was more cost-effective to move and close the Sinai hospital facility and move it over to Grace. And at that point, Alan Cutler and I decided we'd had enough, and we grabbed Phil Goldmeyer, who was my former fellow that was working locally, working for a different branch of Sinai, and we ended up starting our own practice. The two older guys, Phil had been working with an older guy, Arthur Klass, and I had been working with Manny Sklar. Arthur decided to retire. Manny decided to stay on at Sinai, and the new chairman of medicine there offered him a teaching position, so he was pretty secure. And Alan and Phil and I went off into the diaspora, so to speak. And,
so tell me, in the 80s when you first started, what was the environment and the mood at Sinai? What was the atmosphere like there?
The atmosphere was high-level academics, and yet warm, humane, patient care, and warm feelings towards each other. you'd go to the physician's dining room, and there was always a friendly face, and it was just a very comfortable place to practice. You felt like you were providing high quality care, which we were, and you were training people and teaching them top-notch medical care, which we were, doing some clinical research. There was also some basic science research going on there. It was a really robust, exciting environment, but it was great. It was home. It felt like home. It was comfortable, and it was very very challenging when that decided to come apart. I mean, it wasn't perfect. There were issues that were always going on, but we always, it's kind of like at home, you manage your issues and you sort of keep moving forward. But when the outside forces came in, it became quite clear that things were changing, and it was no longer going to be the same, even though the Sinai name was being held on to for
So
purposes.
over that 13 or so year period that you were there, how would you describe the change in atmosphere at Sinai Hospital? Was there a consistency? Did it begin to change in any way?
Well, it was fairly consistent. Sometimes there were issues with the amenities and the patient care, and people said, well, Beaumont's probably a nicer hospital to go to. So patients from the Jewish community may not have loved the location. We were challenged by our location, and but at the same time, we were the community hospital for the community that lived around the hospital, and it was really a great conglomerate. That was sort of how I sold my fellowship to prospective fellows. As I said, we have a cadre of patients from suburbia, wealthy people, and then we have poor people, black and white, from the surrounding areas, and we take care of them all equally. And it's a unbelievable opportunity to learn how to manage all different kinds of socioeconomic strata and patients, and we were committed to that, and that really was consistent throughout the 13 years. That never wavered, and it was a great feeling.
And during the time you were there, what were some of the innovations that you had a chance to either observe or participate in?
Well, there was our class was one of the gastroenterologists who was very interested in laser, and so the use of laser. I think we had some top-notch laser scientists there, and so the use of laser in ophthalmology, the use of laser in various disciplines was promoted, and the use of laser in gastroenterology was really pioneered there. It's interesting that it never really took hold, because there were other devices in endoscopy that were more effective than the laser, but it was sort of exciting to be involved in those research studies. We did some, with Alan's Cutler coming on, we did a lot of Helicobacter pylori studies. We did a lot of
what?
The Helicobacter pylori bacteria that we were talking about, that Alan was an expert in. We did a lot of clinical trials in terms of diagnostic techniques and in terms of treatment, in terms of epidemiology. It was interesting that we took care of the Russian population, the Russian Jewish population, as they started coming into to the area over the same period of time. And coincidentally, I grew up in a bilingual home, so I spoke Russian fluently from the time I was a child. And so even when I was an internal medicine resident in the internal medicine clinic, we took care of the Russian patients. They were all flocking to me because I was the only Russian-speaking resident there. And then when I came into practice, I was the only Russian-speaking gastroenterologist in town, so I would see a whole lot of Russian patients and use my Russian language skills all the time. And it turns out that the Russian population had about a 90% positivity for Helicobacter pylori, so they were a fertile area for our research. So it kind of all came together very nicely. But it was very gratifying to take care of these Russian patients who were just starting out in the United States, didn't have the language skills, didn't really have a lot of Jewish affiliations in Russia, but were taken in by the Jewish community and by the Jewish Family Service, and we provided care for them. One of my fond memories, and this just shows you what Sinai could do, is there was a guy who shows up in my clinic early on in my practice with a very complicated case after having complications of gallbladder surgery in Israel. So he had gone from Russia to Israel. And then he was really in bad shape from his bile duct and biliary tree. I won't get into the medical details. But he came to me, and I realized that he wasn't covered by the Russian Resettlement Service because technically he was an Israeli immigrant as well as not a Russian immigrant. So he wasn't entitled to all the financial benefits, and he required repeated admissions. So finally we figured out what we needed to do, and he needed a major operation. And my friend and colleague Eduardo Phillips was willing up to the task, and he was ready to do that. And so I went to administration, I went to radiology, where we needed a lot of things to be done. I went to anesthesiology, and we got a consensus that we were going to take care of this guy. Didn't matter that he didn't have any insurance coverage, and was going to all be gratis to him. And that included Norma Silver, who was a senior administrator, and that was what was so beautiful about it. And the guy
Seems like a real collegiality.
There was a collegiality, and
centered
there was
around the patient.
Yeah, and here was this Jewish patient who kind of got stuck in a donut hole that he had no ability to pay, and we took care of him and we fixed him, and we were able to take care of him and resolve his problem, and he went on to live a very healthy, normal life for many, many years. And,
do you think that could have happened at other hospitals in the area?
It's hard to say. I'm sure that he could have gotten the care, but just to be able to get the ability to get people to work together as a team and be willing to go to bat for a guy who was in a situation like that, I think it was sort of this Jewish humanitarianism as well as the medical expertise that allowed us to do that.
It was like an organic chemistry to the staff.
It really was.
Yeah. And you mentioned before, when did you start to realize that Sinai was going to be sold?
We heard rumors, and then as time went on, those rumors became reality, and we realized it was probably an unsustainable situation because of the geography, and we knew there was either going to be a move to West Bloomfield with partnership with Henry Ford, and that was what some people wanted, and that sort of fell through the cracks, and then eventually they got an offer that they couldn't refuse, and I guess for the Jewish community in general, it was a win, but it was financially, but it was a loss to those of us who provided care. It was a loss to many patients. It was really a loss to the surrounding community. There was a lot of non-Jewish, predominantly African American employees and patients who really felt that loss dramatically, and sometimes I would go to a different hospital afterwards and all of a sudden see somebody, a black ward clerk, for example, and they would just come run up to me and hug me and cry and say, Dr. Levinson, this isn't the same. I miss Sinai so much. And that's how people felt. It really was feeling like we were exiled and we were going into the diaspora, and we were just trying to make our way. And while Providence Hospital and Beaumont Hospital took us on, it just wasn't the same. There was high quality medical care, but it just wasn't the same. And it took a long time for...
What were some of the differences?
Well, I mean, you go to Providence Hospital. Obviously, it's a Catholic hospital, and so there's, you hear the Catholic prayers, on the PA system a couple times a day. You see the crucifixes in every patient room. I mean, it just wasn't a Jewish experience. It's not to say it wasn't a humane experience, and it's a fine hospital, but it was different.
Yeah.
And Beaumont was different, high quality care, but just not as warm and inviting.
So as you think back, and you mentioned that experience with this Russian patient, what were some of your most memorable experiences at Sinai? A couple that you can think of.
Well,
what are your takeaways?
Okay, so one of the things was that morning report is something that you sort of, they have at a lot of hospitals where you go to morning report, meaning that you come in, patients who were admitted the night before, there's sort of a brief presentation of each of those patients. It's partly a learning experience, partly a let's make sure we're taking the right care of these people. And I remember at other hospitals it was very intense, and when I was in medical school. And at Sinai it was great. It was high quality, and we had some brilliant physicians who would show up to these morning reports, some specialists. So if there was, let's say, an endocrinology patient that was admitted, Chuck Taylor was there, and he would just spew off all of a sudden a spontaneous lecture on thyroid storm or something like that, and we were just like wowed. And Bill Lucher, who was a brilliant neurologist, if there was a neurology patient, he would just teach us. And so that the teaching was just organically built in. It was so dramatic and such an amazing synthesis of really good people, smart people, and not intimidating people, just people that were just there to really teach you. And I remember those conferences as being very warm and great memory, and you just learned how to be a doctor very, very quickly. I have some memories of when Sinai was sold, that there was some conferences that were not so warm and inviting, and there was a lot of antipathy towards the Sinai way, and it became quite apparent that...
What kinds of things?
Well, there was a conference where we were trying to decide where we were going to end up, and there was one physician who
Your group was going to end up?
Well, where all the physicians were going to end up. And there was a You People reference that, right in the Sinai auditorium that just kind of just tore at my heart, that was clearly referencing you Jewish people. And it was disappointing that this safe Jewish practice environment was going by the wayside, and that we were being labeled for no good reason, and that was going to go away.
What were they saying? I mean, what were they saying is good?
I can't even remember specifically what they were saying, but just the fact that it was You People, it was a
That
You People
reference.
It just became very disheartening.
Yeah. So thinking back over the time, and you mentioned a few of them, who were some of the people who had the greatest impact on you in terms of your practice, in terms of your motivation, in terms of your career?
Well, I've mentioned a few. Ron Trunsky was one of the first. He was a psychiatrist. He was a brilliant guy. He was a quirky guy. He had his sport coat, and he had like, I don't know, so many papers in his inside his sport coat every day, and he had, I don't know, patients billing, but then he would also all of a sudden pull out a picture of a fish that he caught, and he would, and here he was showing showing off his fishing prowess.
Or his pockets.
His pockets were full. It was like a magic, like a magician who had anything he wanted in his pockets, and just a wonderful man. Arnold Axelrod was my first chairman. He really was the one that sort of influenced me to come there, and just a brilliant physician, but a kind man, and just mentored me into being a high-end physician, yet being kind.
Mm-hmm.
Mel Rubenfire was then my first. He was the chief of cardiology. Then he was my first boss, and he was a brilliant physician, a brilliant cardiologist. He was a brilliant administrator. He really knew how to run the department and expand the department and make things better. And to this day, he was on our Sinai Medical Staff Foundation for a couple of years, and he had some very innovative ideas, even well into his 80s. Just tremendous impact. Those people influenced me. There was a couple of private practice cardiologists, some who one of them I just saw yesterday, Alan Chernick and a guy named Steve Woodlansky. They were two private practice cardiologists. They were just two regular guys, but their patients loved them. They loved their patients, and they just
Were they at Sinai?
Yeah, they were at Sinai, and they, as a resident, I just admired how they took care of their patients, and everybody influenced me. Chuck Taylor, the endocrinologist, I spent a month with him as a fourth-year medical student. Sam Indenbaum, who was a rheumatologist, who was a brilliant guy, and I spent a month with him as a fourth-year medical student and learned a lot of rheumatology and Menschlichkeit. And then Manny Sklar, who was my chief of GI when I was a resident, and then became my partner and mentor, and he maybe influenced me the most because he was the sort of the dean of gastroenterology in the area. And
then you took his position.
I took his position, and then we stayed in practice together. We continued to be friends until his death, and he was very interested in Crohn's and colitis also, and inflammatory bowel disease. So I developed that interest as well. I took over a lot of his patients. He was the founding physician for the Crohn's and Colitis Foundation for the Detroit area. Then I ended up becoming the medical chairman for the Crohn's and Colitis Foundation Michigan chapter. While I was in that position, I organized a dinner, a gala in his honor. It was a Lifetime Achievement Award. We tried to get Joe Kersner, who was one of the godfathers of inflammatory bowel disease from Chicago, to come to town. That's where Manny trained under him. He was Manny's idol. I actually went to the University of Chicago with Manny for Joe Kersner's 80th birthday, which was one of the most incredible celebrations of gastroenterology ever. The luminaries from all over the country came together to celebrate Joe Kersner, and Joe Kersner gave a couple of lectures that were astonishing for somebody at age 80. Unfortunately, Joe couldn't come to the event, but he sent along some messages which I read, and then Max Fisher, who Manny and I had been involved in some of his medical care. I got Max to come, and Max spoke about Manny, and it was a tremendous event.
Very special.
And sort of as things come around, and 2 years ago I was honored by the Crohn's and Colitis Foundation for a Lifetime Achievement Award, and I recalled a lot of the memories, and it was very fitting. It was a great feeling, and I really owed a lot of my expertise and interest in inflammatory bowel disease to Manny Sklar, who sort of fostered that.
So, when did you become involved with the Sinai Medical Staff Foundation? Who invited you on?
Well, my brother Marty was involved. He was on the board for a number of years, and I'd hear about the meetings from him. And about 10 years ago, he approached me and said, "We have an opening. Would you be interested?" And it sounded perfect. So he told me who was on the foundation board, and I said this was a way to sort of reconnect with my old Sinai roots and reconnect with some Sinai people, and spend a little time with my brother, and it's been great.
It's good.
And then I was able to just recently recruited Scott Lewis, who's one of my closest friends, who was 2 years behind me in internal medicine residency, and I was one of his mentors, during residency, and we've been great friends since. And I was able to
get him to join.
And sort of comes full circle.
Is there anything that we haven't discussed that you'd like to mention?
Not that I can think of. It's an honor and a privilege to sit here and talk with you and to reminisce and talk about what.
It sounds like a very special place.
It really was a special place. I'm sure that's reflected by everybody else who's spoken about it.